Okay, looks like we are live. So that is wonderful. Good morning, Ash. Good morning, Angie. Thank you everyone for being here. My name is Tashmica Torok, and I am the founding co-director of the Firecracker Foundation. I am a Black woman with dark curly hair. I'm wearing a green sweater. My lipstick is like a deep purple, and I have lots of framed pictures behind me. Those image descriptions are for all of our low visibility blind friends. And as you can see, we have an ASL interpreter. During this panel, we are going to only have one person featured by our ASL interpreter to make sure that that's accessible. If you are someone who needs the ASL and it is not going well, you can't see it, or you need something different, please let us know in the chat and we will adjust for access. We really want everyone to be able to fully participate as much as possible. So thank you again, everyone, for being here. We are going to just get right into what we are here to talk about this morning. This is our Protect Black Teens press conference. I see that a lot of you are here from all different walks of life and work. So please do us a favor and just say hello in the comments if you haven't already, and let us know where you are coming from. What is your role in this community, and why are you choosing to be here this morning? We are joined by an incredible group of advocates, community partners, birth workers, and with the support of several elected officials who were not able to make it this morning. But we're all working together to improve maternal health outcomes within the sphere of our influence locally and across the state. Just for the moment, can I have all of our panelists that want to, can we go ahead and have you turn on your cameras just for a second so I can read off the list of people who are here today. We have Angela Waters Austin, the founder and CEO of One Love Global. We have Shatoria Townsend, who is a birth and postpartum doula, certified lactation counselor. We have Mercedes Price, who does prenatal research and is also a doula. Obviously, I'm here, the founding co-director at the Firecracker Foundation. And we also have our client and their family here. They may not be turning on their camera or providing statements, but they are here and can feel and sense all of your love and support. So again, thank you for being here for them. And then Tara Scott Miller, our co-director at the Firecracker Foundation, is also here and will be leading us in a discussion after we do our statements. So again, thank you all. Thank you, panelists, for being here. I am so grateful that you would take the time. You can go ahead and turn off your cameras now. And if there are members of the media that are here that want a panelist invite, just let us know in the chat. We'll ask that you keep your camera off until we are ready to receive your questions, if you would like to voice them yourself. Apparently I muted myself. There are 70 plus registered attendees today, and those attendees include community partners, doulas, public health professionals, members of the media, direct service providers, SV and DV advocates, and Firecracker community members locally and from across the country. We know that this is such an incredibly important conversation, but the first thing that I want to tell you all is that our client and her baby are doing very well. We've continued to check in on them in addition to postpartum visits that we provide as a part of our perinatal advocacy and labor support services. Postpartum visits are our doula's chance to drop off supplies, a few gifts, and check in on the health of the new Firecracker baby and their birthing parent. These visits are extremely important to supporting our TFF clients and their babies, especially after an experience of birth trauma. So just to give you some context about why we're here, just in case you have not seen our media release, in August 2022, a Black teen was admitted to the birthplace at McLaren Hospital for a possible induction of labor. The medical staff charged with her care violated her patient rights by failing to identify those providing care, ignoring her consent, violating her bodily autonomy, refusing to answer her questions, neglecting to manage her pain, and preventing her support people from advocating for her while she was medically vulnerable. Our client experienced birth trauma, racial violence, and medical abuse while giving birth to her first child. Her mother was forced to leave the room and was barred from advocating for her daughter. The nursing staff then weaponized hospital security as a threat of criminalization and violence against our doula. They risked her safety by unnecessarily calling security to escort her off the premises, even though she was already leaving peacefully and of her own accord. Even after the incident was over, a nurse retaliated against her by seeking out her professional contacts to impact her ability to work in the future. Today, I'm going to share her story, our client's story, in an attempt to spread awareness about the real-time experiences of Black teens seeking maternal health care at McLaren Hospital, deliver urgent requests for our healthcare community, and discuss the importance of the Black Maternal Health Momnibus Act, in addition to other legislation that is also critical to protecting Black women and girls, like the Protect Women and Black Girls Act. We'll also briefly touch in on the history of Black birth workers and how we got here, health equity data like the HOPE initiative, and the unique challenges faced by survivors of child sexual abuse when they seek maternal health care. I want to thank our newly elected state senators, Sarah Anthony, Senator Curtis Hertel, Senator Erica Geis, and their teams. They have been so supportive in this process. Although they are not able to be with us here today, they have all committed to uplifting our message. They have been supportive of this event, and they continue to advocate for the solutions that emerge in eliminating adverse health outcomes that disproportionately affect Black mothers and infants, as well as supporting doulas who are there during pregnancy, labor and delivery, and for postnatal care. Let's get started, shall we? No matter the outcome of these efforts, we are all here to show love and support to the TFF client and parent most impacted by this terrible experience. We cannot control how the hospital responds, but we can show up as a community that says, we believe you, what you experienced was abusive, and we're going to work to prevent it from happening again. So with that, I'm going to invite Angela Waters Austin to make her statement on behalf as the founder and CEO of One Love Global. Thank you, Angela, for being here.
Thank you, Tashmica, for inviting me to be here. And let me begin by saying to our team and your family, while I can't see you and I've not met you, I see you. I believe you. I love you, and we're going to do what we need to do to make sure that you have everything that you need to heal and to be whole and to know that your community is here to keep you safe. Thank you, Tashmica, for opening this critical conversation. I'm here to talk about human rights because so often Black women, Black children, and especially Black girls, Black teen girls in particular, are seen as less than human, adultified, hypersexualized, and as we are learning, criminalized. And this criminalization begins very early in life. We see children in elementary school in handcuffs, being brutalized by those who are paid with our tax dollars to protect us and to protect our children. So to hear the thread that not only was there harm done to mom, to baby, to family, but to understand the threat during a time where love should be poured out, that the threat of being criminalized was used against a child. And I really want to underscore how important it is for us to pay attention that this is not an isolated incident. And I want to lift up the track record, the data, So I'm going to bore you with data for just a minute. In our local community, in recent years, there was an entire year where every young person who was arrested, charged, sentenced was a Black youth. 100%. How a data point like that goes under the radar in our community is a travesty. And what it does is it exposes how little care and concern there is for our children, and also the lifelong impact that these encounters have and the criminalization of our children has on their future. I also want to lift up how important the work of the Firecracker Foundation is, and another set of data, the Health Opportunity and Equity Index for Michigan, that shows that only 24% of people in Michigan live in communities with low sexual assault. Now that seems like it would be a major headline, and that data gets buried, and it gets buried because of who the survivors are. And it is our job, it is our duty to tell the story behind that data, to put a human face and a human heart and a human soul on the data that should be driving policy, that should be driving accountability, and why organizations like the Firecracker Foundation must be invested in. We have to have a new vision of what public health looks like, of what community safety looks like, and it starts by investing in those who serve our most directly impacted, our most vulnerable, and our most targeted people in our communities, which are our children. We have to show up for Black children, and I'm just so grateful to be a part of this conversation today, and trust and believe that this is not the last conversation we're going to have. And Tashmica, One Love Global is here for you every step of the way. Thank you.
Thank you so much, Angela. Thank you for being here. And thank you for your first words. You know, I see you, I believe you. And we are here, we're in the work to try to make sure this doesn't happen again. So next up, I'm going to invite Mercedes Price. I don't see Shatoria on our list of panelists. So Shatoria, let us know when you arrive. But for now, let's go ahead and hear from Mercedes Price.
Good morning, everyone. Thank you again for being here and giving us the opportunity to have this conversation. So I just wanted to talk a little bit about how birth is sacred. So if you have been pregnant before, you do recall those feelings of being afraid. You recall those feelings of not knowing what lies ahead. When you head to the hospital to have birth, you have all those feelings, you have all these feelings of excitement. And if you have your doula with you, you know that you have a safe space. Doulas are that safe space for birthing families. We provide comfort, support. We also help with research-based, evidence-based information. And we help get you to the other side. So when you arrive at the hospital and you're feeling anxious, you're feeling scared, the last thing you need is for your support person to be attacked, because that's supposed to be your safe space. Your doula is your personal cheerleader, and they help you have more of an at-home experience and kind of give you that love and support that you can't get from people who are, medical staff and they have their own jobs to do, forms to fill out. They already have so much going on. So to hear that this young lady's doula was attacked is really disheartening. In such a scary time with the medical model, birth is not being treated like a normal physiological process. So regardless if you're in a hospital, if you're at home, wherever you are, we know that birth will take place as it needs to. And when you're at the hospital, you're not supposed to be in harm's way. Medical providers take an oath to do no harm. And in this story, it sounds like that's the opposite of what occurred. So doulas do help you mitigate that unfamiliarity of the hospital setting. They help to make you comfortable. Anything that stops a doula from doing her job is causing harm. That's creating more risks. A doula's job is to mitigate the risks of the hospital, to mitigate that unfamiliarity, to help make a mom comfortable, to help direct the birthing family on how to keep that birthing person comfortable, happy, and making sure that her needs are met. A doula's role helps fill in the gaps where the staff cannot. So a doula resets the room. She provides comfort. She also just encourages and empowers the birthing person. So some things that we know from research is that just being Black alone increases your risk of maternal mortality and morbidity. Michigan has some of the highest rates in the nation of maternal mortality and morbidity. So a doula being present is supposed to help mitigate those risks. I'm sorry. I just want to, again, hold space for this family, because we already know that this is like a scary scenario in general. And any time that something like this occurs, fortunately, we know that this isn't the first time this has happened. This is just the time that we're been fortunate enough to be able to call it out and hold space for this family. We hope that a formal apology will be made, and a case will be opened so that the family can get some sense of comfort and justice for this scenario. My heart just hurts. I'm so sorry. My heart just hurts. Again, we know this isn't the first time that this has occurred, but it is so important that we bring light onto the scenario right now and call out the harm that has been done. And hopefully we can repair these types of relationships moving forward so that doulas can do their jobs and the hospital staff. We can all work together to keep birthing families safe. And create safe spaces in hospitals where there aren't presently those opportunities. So we are looking forward to finding solutions and to being heard. We're looking forward to having some changes in policy and perhaps some training for staff so that these types of situations don't occur in the future, and that we can continue to protect our birthing families, especially our Black and Brown birthing families who are being most egregiously affected. Thank you.
Thank you so much, Mercedes. Thank you for reminding us to take a breath. We have been working on this since September, and I've received a lot of calls on behalf of our clients in the past, with someone on my team completely at a loss as to how to help, because some institution is doing harm and they feel powerless to do their job. And this was one of those moments where we got a text and it had all already happened, and there was not really anything that we could do to go back in time and make this thing not happen that we had hoped that this program would prevent. That we had hoped that our ability to stand in the gap between our pregnant and parenting teens and these institutions would somehow mitigate the violence that they experience at hospitals. And to know that even while we're there, that harm is now extending beyond our clients and up into impacting our doulas is heartbreaking. And despite all of the things that we say, we can call racism a public health crisis, we can, write packages of bills, but ultimately this is about people who are doing harm to children in community. And we have a lot of work to do on our spirits, on our hearts, on our collective beings to transform our community so that this doesn't happen again. And that has to happen through radical transparency. We got to talk about it. We have to be in community together. We have to grieve together when these things happen. Because one thing I do know is that institutions will invite you to meetings and they will make big, bold declarations. But the real happens when we are on their premises. And it feels really critical to me that we are not silent and that we do not submit another email, another complaint, that we actually come in as a community that is committed to ending the harm that these racial inequities cause at hospitals against our children. We have to, because although our teen is doing well and her baby is doing well, she could have died, right? We know that Black women and Black babies are dying. And so we don't have time for more meetings. We don't have time for more declarations. What we need is accountability. What we need is restoration, transformation, and real change, and people who are committed to doing that work. So I would love to, we're going to continue with our statements. We're going to continue moving through this conversation. I'm wondering if Shatoria has joined us yet. If not, then I'm going to move on with my own remarks, even though I sort of made some. But I have not ever had an opinion I can't share. So I'm going to go ahead and make my, go ahead and tell you the story of what happened and why you were all here. And then Tara is going to facilitate a longer discussion between myself and the panelists. And as always, the client's family and client is here today, and they can also chime in if they're ready. The first thing I want you to know today is that these, as Angela said, these problems are not new, but I want to take it even farther, even further into the history of birth work and the granny midwives. So I was reflecting on this press conference and realizing that I am here because of a granny midwife who caught my grandmother and probably caught many of my ancestors who were enslaved. And they developed over 200 years of practices in the global, in the United States, but also in the global, or in the South, right? My family's from the low country of South Carolina. And at a certain point, they were blamed for the maternal health disparities. They were blamed for the infant mortality, the maternal mortality rates, and they were criminalized and marginalized and pushed out of this work by legislation that was created by white healthcare workers who thought they knew better and caused a lot of harm. And we know that a lot of the problems that we are seeing and that we are fighting for change is still happening. And a lot of that goes back to the roots of pushing Black birth workers out of birth work. So we had worked with our client, our doula worked with our client to create a birth plan. They had been in regular contact about that birth plan. And shortly after our client was admitted to the hospital, she started texting our doula and saying that she was having a really hard time communicating her wishes to her nurse. She wanted to keep her placenta. She wanted a golden hour, which is the first hour where there's uninterrupted skin-to-skin contact. And it's critical. This is a critical time to help the baby regulate their temperature, control their respiration, and it lowers the risk of low blood sugar. There's a lot of health reasons to have a golden hour. Unfortunately, our client just felt like they didn't feel like they were not getting their questions answered. There was no indication that the nurse was going to respect her birth plan. And she's communicating this with her doula, who decided, you know what, they were trying to coach from afar, but it wasn't working. So they decided it was time for them to go to the hospital to help support her on site. The client described the nursing staff as hostile and aggressive. Now imagine you're giving birth to your first child and the people who are caring for you are treating you with hostility and aggression. They told our client, they told our doula that she would need to provide her certification as soon as she gets to the hospital, despite there not being a policy that requires her to do so. So she did, she showed it, and they allowed her to see our client. But later on, they called and said, they called some of her professional contacts to say that her certification was doctored, that it didn't look real, and tried to again say that she was faking her role. So one of the things I'm going to do is I'm just going to highlight our patients' rights and responsibilities. Each patient has the right to be informed about hospital policies and practices that relate to patient care, treatment, and responsibilities. Each patient has the right to be informed of available resources for resolving complaints, conflicts, and ethical issues. Patients unable to protect themselves have the right to have access to protective services if appropriate. This is from McLaren's Patients' Rights and Responsibilities. So the fact that our teen was not given information about how her birth plan was going to be respected, and how our doula was required to share certification, even though that was not a part of the policy, is confusing at best and is a violation of their patients' rights and responsibilities. Our client communicated her wishes clearly, and they were disrespected and ignored. Our doula shared her certification, and it was still questioned, and she was treated like a liar and a fraud. The nurse said if people didn't have to show their certification, then anyone could be a doula. And our doula responded, anyone can be a doula or a labor support companion and shouldn't face this kind of hostility and aggression. At another point, our client asked for a birthing ball to help progress her birth, help with her comfort. And the nurse replied that they didn't have enough and that other mothers needed them more. So I don't know if that has to do with not having enough supplies. We talk about the conditions at the hospital, but McLaren is billing itself as the new place for a patient-centric approach to pre and post labor. How is it a patient-centric approach when you tell a teen client who is in pain birthing that other mothers need the supplies more than she does? During this incident, the nurses never identified themselves by putting their name on the board. She never knew who was responsible for her care. And at the end of this experience, one of the nurses even covered her name tag so that our doula couldn't identify her later. From the patient's rights and responsibilities, you have the right to know the names and roles of everyone who cares for you. You have the right to information about your diagnosis, treatment, and possible medical outcome. She didn't know what their plan was for her birth. They didn't share that information with her. They wouldn't answer any of her questions. Our doula approached the nurses station to ask the nurses if they could come answer our clients' questions because they had gone unanswered for a long period of time. Now, in the patient's rights and responsibilities, it says you are responsible for asking questions when you do not understand or are not satisfied with the information or instructions given to you by your physician and healthcare team. We were asked to ask questions and they were ignored. We have a right to understand as clients, as patients of the hospital, what the plan of care is. And they refused to share that with her even after she asked multiple times. When our doula approached our client's nurse, she was rude and aggressive and said that she had answered all of the questions and that the doctors were busy doing other things, so she must wait. Now, our teen was naming that her pain was at a 10 at 2. I want you to understand that she was in active labor and a lot of pain, and her pain and her questions were not being addressed. When she asked the nurse if anyone could just come and talk to our client, she said that they were busy and that they couldn't. And so she asked to speak to, our doula asked to speak to a charge nurse, and the charge nurse had been sitting there the entire time watching that conversation unfold. There are moments where a nurse was standing over our doula, disrespecting her and waving her hands in her face, while our doula sat in a chair trying to maintain professionalism and a respectful stance, and to try to de-escalate the situation. There are moments where the security guards mocked our doulas and mocked our doula as she left. You have the right to receive considerate, respectful, and medically necessary care, and to not be discriminated against for any reason. You have the right to speak privately with anyone you choose. Another thing that the nurse said to our doula was that she is not the boss of the nurses, that she can't tell them what to do. And so our doula really worked hard to direct all of her conversation to the client and the family, only speaking to the nurses when it felt urgent. And unfortunately, that didn't work. It still didn't work. Let's see. There were also threats being made to the client before the doula even arrived, letting the client know the hierarchy in the birthing room, being scolded about poor outcomes if they are not compliant with the nurses. Again, our client was complaining about the pain, and at a certain moment, she asked for the removal of the internal fetal monitor, and the nurse refused to remove it and told her that nothing could be done to manage her pain. That was contradicted by an intern that told the doula that the pain could be managed. So our doula and our client were getting different information from the medical staff as well. The care staff continued to attempt to place a catheter, even after our client asked them to please stop multiple times. This is violating our client's body. There were painful vaginal exams and a placement of the catheter. These things should be done with consent and respect to the client's body, especially when she is experiencing high levels of pain. She assessed her pain at a 10 while this was happening. This part upsets me the most, so I'm just going to take a minute to breathe. It's hard for me to separate this from an act of sexual violence. When our client is medically vulnerable and experiencing extreme pain, and medical staff are causing harm to her in this way, it is absolutely violence. And I'm so angry that we didn't have the ability to stop it because we didn't have the institutional power in this moment. When our client's mother stepped into advocating for her child about not receiving proper care, about the fact that her pain was not being addressed, the nurses began to accuse her of being verbally abusive to everyone, and they told her she was no longer welcome in the room with her daughter. So now our client is really only has her doula. And our client and our doula reflected that the mother never was abusive to anyone. She expressed her frustration, as she rightfully should have, and as well within her rights in terms of the patient's rights and responsibilities. And they demonized her to other members of the staff in order to get her removed from the room. We've all complained. They complained the day of. We submitted a detailed incident report. The mother of the client certainly submitted a complaint as well. And according to patients' rights and responsibilities, we're responsible. You are responsible for telling your healthcare team when you are not satisfied with the care or services provided. If you would like to discuss ethical issues related to your healthcare, or when you have concerns about possible abuse or neglect in your home. Well, the abuse and neglect was not happening in this child's home. It was happening in the hospital. It was happening through the care of medical, through the care. It was happening in a healthcare environment where our teen client was giving birth to her first child, where our teen client, who had a birth plan with a doula supporting her, and where they were both attacked and abused. The nursing staff then weaponized hospital security as a threat of criminalization and violence against our doula. And for those of you who are aware of the impact of law enforcement and policing on Black people and Black women, know how dangerous that is. They retaliated against her, seeking out her other professional contacts. And it absolutely has impacted her reputation and has harmed her business opportunities. Not with us, obviously, but they did come for her reputation. There's a lot more to this story in terms of what the nursing staff did and said about our doula, but we have all agreed to not center this work around our doula, because the primary person that we are advocating for, the primary person that we all care for, that our doula cares for, that our PALS program cares for, is our clients and our future clients. And so we really want to focus on how do we ask for what we need from McLaren as it pertains specifically to our clients. So a couple things. McLaren is already naming a shifting of policies to push doulas out. Let me explain what that means. Basically history is repeating itself, right? They're talking about policies that require credentialing or credentials. Keeping a list of approved doulas that are connected to networks. It has to be mentioned that most of our local doula networks are white-led or are not representative of the Black community that we serve. They are talking about requiring doulas to sign agreements, which on face value always sounds good unless you're an advocate. Our agreements are with our clients. And our agreements with our clients supersede any agreements with any institution, because that's the only way that we can properly advocate for them. And they're saying things like they want doulas to have to sign in. Doulas don't even need to do that, because they can also just be labor support companions. As our doula said, anyone can be a doula or a labor support companion. What needs to change is the hospital and the staff and their understanding of how they are participating in white supremacy. So what we're asking the Birthplace and McLaren Hospital to do is to, number one, apologize. Our teen deserves an apology. And so do her labor support companions, and so does our doula for the harm caused. I want them to host an in-depth and collaborative case review. I want to have us all at the table, mostly so that they can hear the impact of the harm that they caused on everyone involved. I want McLaren to, and I shouldn't say we want, but I definitely want, we want them to commit to formalizing or updating policies to ensure that Black teens and doulas are welcome and safe at the birthplace and McLaren Hospital. And we want them to pledge reparations to BIPOC-led orgs leading health equity work when patient rights are violated as a way to share the cost of the health inequities McLaren Hospital causes due to racism or anti-Blackness. There is a cost to this. There is an emotional individual cost when we talk about birth trauma and racial violence, but there is a community cost when we are not well. Who pays for that? Who pays for the time that we take to help our clients heal after they are harmed? Whose responsibility is it to repair the harm? So that's what I have come here to say. And I would love to introduce our moderator, who's going to handle the rest of our conversation today. So Tara, would you join us, please, our co-director?
Good morning. We invited you all to leave
I just
questions.
have to point out that we didn't dress the same on purpose. It happens all the time.
Always does. And it was too late to change. So we invite you to leave your specific questions in the Q&A box. You should find that on the menu, the bottom of your screen. It's just easier to lift up questions from that box rather than through the chat. So I'll give you a moment to just process what has been shared and enter some questions. I will ask them directly to the panelists and invite them to popcorn in as they are ready. So the first question comes from Rebecca. What can we do to support your efforts, both as individuals and as community organizations?
You know, I think number one, showing up. Number one, we are showing up and we are taking these conversations public. I think we have to have a willingness to go beyond the series of meetings that we are called into and push for tangible, practical changes. So number one, thank you for showing up. I think that there will be more actions coming that we will definitely be circulating, because this is not something that we want to put to bed. So please join our, sign up for our advocacy alerts so that you can keep and follow all of our social media so that you can keep in touch with us as we continue through this process. And of course, we can always use donations. We will be launching a Healing Justice mutual aid fund, and those details will be coming soon. So yes, those are all things that we need. We also need everyone to do their own work, right? Like we all have bias. We all have ways that we have grown up and cultivated white supremacy in ourselves, for lack of a better phrasing. And so because these harms are happening, you know, if you are in health equity, if you are a healthcare provider, this is work that can be done outside of the institutional framework, because you are ultimately responsible for the care that you are providing to BIPOC teens and their families. So I would also encourage that anyone in that field do their own work above and beyond what is required by the institution.
Okay, a few more questions have come in. And Doak, great to have you here. I'm not sure if your question was answered by Tashmica, but just to lift Doak's question up again, will there be a strategy for organizing a community response to McLaren? Any actions with a specific ask, apology, but hopefully more than that. So just asking for a little bit more detail about strategies moving forward.
I'm just going to leave my camera on for this portion. There is going to be a community-based response. And one of the things that we would love is if you are someone who has positional power and influence, as well as a connection with McLaren Hospital, we ask that you advocate on behalf. We are not the only ones who can complain. You know about it now, right? And so if you have connections at the hospital and can help advocate on our clients' behalf, and when I say our clients, I mean more broadly, please connect with us and help us develop that strategy. Because so far we have heard nothing from McLaren. And, you know, to jump to the next question, even though I'm not supposed to be doing that. McLaren has not responded to anything. Not in a satisfactory manner to our client. There was not a full apology that addressed everything that happened. And so we're still waiting to hear from them on that. So yes, please keep watching. There will be, but starting out, we'll provide information on how to contact the hospital about this if they don't contact us first, and you are welcome to use your own contacts to help move us through that process.
Yeah, I do see a question from Chuck, and it is, what is the organization doing to include fathers into this space to advocate for the moms dealing with this issue?
Well, the perinatal advocacy and labor support services include fathers in the creation of the birth plan and in the coaching around labor support and in the coaching around parenting. So we do not leave fathers out. We definitely support their involvement and will continue to do so because we recognize that that is absolutely important.
I want to make space for Shatoria Townsend, who was one of our invited panelists. Shatoria, if there are any things that you want to jump in and respond to, or she has a client that's preparing for induction, and so she mentions that she's willing to respond to anything at any point. So I just want to open up that opportunity to Shatoria for a moment. Okay. Two more questions have come in. One from Gabriella. What can we do when an appropriate birthing contract is brought into the hospital for all parties to abide by, and it is still being disrespected? Ideas from the doulas on the panel?
Hi, Story here. I will jump in. Let me get my camera. So, hello everyone. When it comes to addressing the birth contract, I know, I know that what normally happens in cases that I have been a part of is I always stress to share that contract with your providers, bring it with you, have a copy on your phone. I have a copy on the phone with me in my doula bag when I bring it, and just creating that space to say, hey, we established this in our birth plan. How can I always go back to the parents and ask, are you comfortable with this? Is there anything that we can do to help you further your understanding of how we're deviating from your birth plan? It is their birth experience, and I cannot stress that enough. That is their birth experience, and that discussions are always available. Times to answer questions are always available. So stressing and just bringing it back forth is it's a way to be firm and also be heard to not be rude. So it's a balance in that space and how to do that. It can be frustrating for the doula and the family, but advocating for that family in that space is the best way that I think to address that situation and move forward.
Thank you. One last question for the panelist. Is there anything else that has not yet been named that you'd like to speak to regarding the structural determinants of health?
Angela, do you want to speak to this question if you have a minute?
Sorry, yes, sure, because I've been lighting up the chat here. Absolutely. So many of the choices that people believe that they have are actually choices that are made by other people, and the systems and structures that maintain the kind of inequity that we see in the data that I shared in the link. Infant mortality rates and maternal mortality rates for Black women are really abominable. Like there's no justification whatsoever to see that kind of data and to suggest that it could be anything other than the false belief in a human hierarchy that's based on race and the kind of care that people deserve or don't deserve. And so all of these factors are actually creating the conditions that produce the data that we see. So these are the social determinants, the kind of care we receive in hospitals, the lack of access to primary care on a consistent basis. Health is a lifelong journey, and the divestment, the defunding of Black lives begins in the womb. And we have to be clear that it is the policy and the systems transformation work that has to be led by directly impacted people. The investment has to be at the community level where people actually care about the people that they serve and are accountable to those lives. And I'll just add on that I'm grateful for all of the counties, for Ingham County Health Department, for Ingham County Board of Commissioners that declared racism a public health crisis. And this is why the COVID pandemic exposed the rampant inequity across every system, from our education system, where we say, well, we'll just learn at home, and then you find out how few homes actually have access to the technology needed. How many families are actually struggling just to make ends meet, and how all of these factors compound and create an undue amount of pressure on mom. And it doesn't just change because you have more education or you have more finances, because it's Black women who have to work harder and strive harder and hold down more, that the higher you actually climb and achieve, the more likely you are to actually risk your own health as a mom and for your baby to actually be more at risk. So it's not just an economic factor. We have to look at what's underneath and what's behind this data. So thank you so much to our mom and for being willing to allow us to love on you and to advocate for you and to show up for you. Thank you, Tashmica.
Other questions in the chat box, and it's been an overwhelming response. So thank you all for showing your support and sharing resources. Yes, the biggest question, didn't Ingham County declare racism as a public health crisis? And what is Linda Vale doing, or what has she said in response to this incident at McLaren? Can you speak to that?
So I reached out directly to Linda Vale, both via email, and I saw her at an event on Friday night and invited her to attend this event or submit a statement. And she was unavailable to attend and didn't really know what statement would be appropriate. So I don't know that she has done anything to support our calls, but she has been fully informed and has been on every email that I've sent outside of the obviously private ones. So I was hoping for more from her. And I'm hoping for more, to be frank, from our elected officials too, because that question for me that I struggle with is like, what do we do if these things don't work, right? Because the outcome of this was that we just watched our teens suffer. Because our doula wasn't going to get arrested and she didn't want to make things worse. She was trying to de-escalate the situation. So then what do we do? Because it is not enough to declare racism as a public health issue if when we are on the ground providing these services, we can't do anything but watch our teens suffer, watch our clients suffer. That cannot be the answer. So I am hoping that one of the things that comes out of this conversation is a real path towards accountability that is assured by our elected officials, by our public health officials who are making a commitment to ending racism as a public health crisis, rather than just making a declaration and letting us work it out on our own, because we need help. We need help and we need it urgently. We have more clients that are going to have babies and they are not going to be able to escape this hospital system. This is what we have to work with. So what is it that we are going to do as a community to make sure that this doesn't get swept under the rug, to make sure that this doesn't continue to happen? And so one of the ways that we are hoping on a broader scale is through the Momnibus Black maternal health legislation. And there's also the Protect Black Women and Girls Act that will be circulating that is really key and groundbreaking legislation that will help us on a legislative level. But what do we do? Again, what do we do when this happens? Because I can tell you a lot of people didn't want me to hold this press conference because they were worried about the way the hospital was going to respond. But when our teen has already experienced this amount of harm, what else could they do? What else can they possibly do to us that they haven't already done for hundreds of years? So what are we actually afraid of?
We have reached the end of our time. Tashmica, I will let you close us out.
Thank you, Tara. Just to address one more question, I see a member of the media is asking about the scope of our work. How many births have we have been successful? Mike, I'm going to invite you to send me an email and I will send you more details about that since we are at our time. And I can circulate some of that information later on. So what's next? Here is our plan for what's next. Again, we are asking community members, including our public health officials and elected officials, to use their personal and professional connections to advocate for Black teen mothers and birth workers by calling on McLaren to participate in this transformative and restorative accountability process. That we invite you to use the Century Foundation's new interactive legislative tracker to keep learning about the Black Maternal Health Momnibus Act, help spread awareness and support its passage. We'll be posting a lot about that this week. We are always accepting donations at the Firecracker Foundation, but we also need stuff for mutual aid. We need Meijer and Kroger gift cards for our pregnant and parenting teens. We need diapers, wipes, and other supplies. So we will definitely be sharing more information about that soon. We will continue to advocate for BIPOC pregnant and parenting teens by providing trauma-informed care, collaborating with community partners, and practicing radical transparency by calling attention to inequitable care whenever necessary. Members of the public, anyone can sign up for our advocacy alerts to hear updates on this and other incidents that require a community-based response to issues related to youth survivors of child sexual abuse. If you need anything, you can, if members of the media need anything, you will be getting a press release, so you can reach out to me later. And again, I just want to thank you all so much for being here. We really, really appreciate everything that you all do in this community and the way that you love on our youth. It's critical. Yeah, thank you so much. And I'm sorry, I forgot to share one more thing. I know that people are, of course, people are starting to jump off, but as in an effort to center our teens, our client's voice, she just sent me a message that said, hey, I never mentioned it to my doula, but I would like to mention that I also had a birth plan for my C-section, and they did not follow any of that either. I didn't even get to see my daughter until like 10 minutes after I delivered her. And this is the worst part. And another thing is, when they were checking if I was dilated, a nurse told me I should not be scared because, and forgive my language, but this is a direct quote, because a dick is bigger. So if that does not put fire in your belly to advocate, to practice radical transparency, to fight, to find alternative paths to accountability for people in these medical institutions, I don't know what will. But I know I will lose sleep over this. So I look forward to being in community and connection with all of you as we continue to fight to improve maternal health outcomes and infant mortality outcomes for Black and Brown youth in Lansing and across the state. Thank you so much. Have a lovely day.